Sociology is like a big puzzle, trying to figure out why people behave the way they do and how they might act in the future helps us understand beyond the superficial. By studying different people and how society works, we can gather social pieces that help us make better decisions on how to make the world a better place. By studying different people and how society works, we can gather social pieces that help us make better decisions on how to improve the world.
Beyond birth, doulas, breastfeeding, families, and community. Welcome to another edition of Sociologically Speaking. My name is Raina Risper. Today, we highlight the importance of breastfeeding and how families and communities can support mothers through this journey. We will also discuss the roles doulas and midwives play after childbirth.
There's a thing that happens when a baby is born and the baby's in your hands, because the baby goes up to mama. That's mama's baby, right? So the baby is born, and there's a thing that happens when they expand and they do that first breath. Because in the uterus, they do what's called breathing movements, where the expansion of the rib cage. But when they come out and they take that first breath, a lot of times when I'm moving the baby up, I can feel that happening. It's such an incredible feeling. Watching them be aware of what's going on. Those are the things that are special to me. Watching birthing folks when their baby comes out, and I often will invite them to reach down and pick up their baby and bring the baby up to them, and watching how they change. This is my way of saying it. They change from pregnant woman, pregnant person, to parent or to mother. You watch it in their face, because the reality sets in that now, I call them boss babies. The boss baby is here. Your world is getting ready to change, and watching them make that spiritual, if you will, and psychological transformation from being, whether this is first baby or whatever number baby, each time you watch that happen. And because each pregnancy is unique, I don't care how many babies you have, each baby is unique. And I'm going to stop because I'll keep talking. I keep talking about this.
You just love babies.
Yeah, I love the process. I love brand new people. For me, it's God's way of saying the world keeps going on, no matter what kind of crazy stuff is happening or what kind of great stuff is happening. And I love the concept of being privileged to watch people move through this very powerful thing that happens to them.
Daddy Adam, come on over here and put your name on your baby's birth certificate. What you gonna call him, Adam Jr.?
I reckon.
Today we are here to speak with Natasha Sage Elbasma. She is the executive director of Next Generation Family Services. She is a lactation consultant and also a child passenger safety technician. Natasha, thank you so much for being with us today.
Thank you for having me.
What are some of the common challenges that new mothers face when they first start breastfeeding?
So one of the biggest things I would say is lack of resources. Depending on the community that you live in, it can be really difficult to find lactation professional. It also can be difficult to get the education that definitely isn't required to breastfeed, but is also helpful with that journey. And then also, too, even just the lack of financial ability to pay for those resources, too. And then in general, with families who are breastfeeding, I always just say that it is the most natural thing that you will do.
How do you help the doula with the mother?
But with the doulas, oftentimes we really it's about knowing the resources and connecting. And that can go both ways. Like sometimes maybe a family didn't use a doula prenatally, but I'm connecting them with a doula during that postpartum period because I can tell that it would be something that would be really beneficial for them. Maybe they're really struggling. Doulas can obviously give that proper lactation education right from that first latch, and the hospital or, birthing center at home and give that extra support that family might need.
What would you say to a mother that has had a C-section and she's decided that she wants to breastfeed?
Definitely. I had 3 C-sections, so when I breastfed with all of mine, it can obviously, having a major abdominal surgery can make it a little bit more challenging. It's not as easy to get up and, get the baby yourself, but it's definitely not that it's impossible. And sometimes it is about just being more aware of positioning so that it feels better for your incision. So a lot of times families like to do like the football hold with breastfeeding after a C-section. And then any meds that they're giving you are really safe to take while breastfeeding too. So I know sometimes families are worried about that, but that's something that they've already taken into consideration.
So I'm going to ask you about the infamous breastfeeding in public question.
So I always just encourage families to do what works for them and realize that what works for them might be different than what works for me or for somebody else. Thankfully, I've never had anyone say anything to me about breastfeeding, but I definitely always say people just need to mind your business. And not quite about breastfeeding in public, but my husband always tries to remind me or tell me when I should feed Knox, and I always tell him to mind his own tit. So everyone just needs to mind their own tit.
Let's talk a little bit about breastfeeding. Breastfeeding is one of the most important parts of having a baby, in my humble opinion. Tell me what you feel about breastfeeding, if you're still breastfeeding.
Yeah, I am still breastfeeding, so my daughter will be 2 next month. And in my family, it was just kind of something that was expected, which I know is not always the case, especially for BIPOC mothers. But I never thought that would not be part of my mothering journey. And it was easy with my first child, and it was a challenge with my daughter, who I'm currently breastfeeding, so that she would not latch correctly. She just didn't open her mouth. So we went through about 8 weeks with a lactation consultant where I had to be weighed weekly at the doctor's. I would go and we would try different positions. I had to pump on top of breastfeeding to try and get my milk supply up. And it was really hard. It was such a challenge, and I felt so defeated at times that why can't I do what I am supposed to do? I saw a lactation consultant, and she was a Black woman with larger breasts, so it was easy for her to know how my body works, the challenges that me and my daughter may face with different positions, because she had a similar body style. And then we also went to Capital Area Baby Cafe, where there were lots of other breastfeeding mothers. We would kind of sit on the floor and all nurse our kids, but to know the challenges that I was facing, I wasn't alone. So I didn't feel like something was wrong with me, that what I was experiencing was actually a natural part of a breastfeeding journey. It's just not something that people openly talk about.
What is your sentiment when you breastfeed in public? What is your husband's sentiment? Is he supportive?
He has always been supportive. And a lot of times I get supportive comments from other women that they're proud that I'm feeding my child. I've only had a few comments were like, that's inappropriate, but I think the times are changing, and everyone, if they don't already, needs to accept that feeding children is a natural part of motherhood, and we shouldn't be shoved away in a closet or told that we have to go pump in a bathroom because no one wants to deal with it. That it is just a part of a natural process. It's normal. And so I have experienced a lot of support in that area.
Working with Allie, I've known her for a while, and we met at the WIC office, and then she saw me as a private IBCLC with her second And she was definitely, I would say, someone who had a good milk supply. And thankfully, she was able to advocate for herself because I think her physician was making her feel like she did not have a good milk supply. And so that would be one of those cases where it becomes like a perceived low milk supply, where like we think that maybe there is, but there's really not. Some babies just need a little bit of time. And so when they're able to come in and do a weighted feed and we kind of see like, wow, this baby is actually transferring good amounts of milk, and then doing those like weekly follow-ups can be really helpful to, one, give them peace of mind, give their physician peace of mind, but then two, for us to make sure that we're following it closely in case there is actually an issue. Birth in general and having a new baby, that's kind of just like how it is. Like, you don't have control over anything.
Just go with it.
Your baby really runs the world. You know, breastfeeding
and
is
they're
different
also
for everyone.
different.
Deliveries are different for everyone. Baby Cafe is really an international organization. So it is a license that Expectant Parents Organization holds through Baby Cafe USA. So we provide lactation support for families for free in the area. I think there's only 3 baby cafes total in Michigan, maybe off the top of my head. And so we obviously provide that professional support, but we also encourage peer-to-peer support. So the families are, you know, gathering together, discussing, sharing their experiences, especially, you know, families who have breastfed previous children, give a lot of knowledge and support to those new families too. And so that is a free group. Fathers or just support people in general can support families who are breastfeeding or in that postpartum stage by helping with, you know, the little techniques and like helping to set up, like making sure that they're comfortable with breastfeeding, but also just taking care of the baby in other ways outside of feeding if the parent is breastfeeding. There's lots of things that you can do with a baby that are not feeding necessarily related. There's giving them baths, doing skin to skin, taking them for walks, baby wearing, you know, allowing the birthing parent to, you know, get a nap when able to and needed, and then just being very kind and just understanding and patient, because it is an emotional roller coaster after having a new baby. So, you know, we all know that kind of, you never know what it's going to be that your support person says that kind of sets you off. It makes you feel like they don't think that you're doing a good job. And so really just being encouraging and being mindful of your words. You will have moments where you're like, you caused this, you did this, and just being patient and supportive and connecting them to resources, helping them get connected with groups or friends, other new moms, you know, taking them to breastfeeding support groups or a newborn group, library playtime, like reading time, anything like that can just be helpful to get them kind of into their new normal. I have used a doula. For my first, I had a doula because I was really hoping for an unmedicated vaginal birth. I ended up having an emergency C-section. He had meconium aspiration, which is having their bowel movement in the womb. So he needed some time in the NICU. But even in that event of an emergency, having a doula was so helpful because my partner at the time had to go to the NICU with the baby, and I would have been alone in the recovery room. So my doula was able to be there with me and to help me with getting the pump set up, and you're so groggy after a C-section too. So that was really helpful for me to have. And with my second, I also had the same doula, and it was a failed induction that became a C-section, and it was still just as helpful to have just that extra person in the recovery room.
Can you discuss the different types of car seats available and how parents can choose the right one for their child's specific needs?
Parents who have infants or children under 1 are starting out with that bucket seat because it's easily portable and it can be nice and handy to have when they're that little. But they can also be rear facing in a convertible seat. And then it is recommended for children to be rear facing until at least the age of 2. Some children can continue on rear facing past that. as long as they fit for the recommendations of the car seat. And then after 2 or whenever they hit either their height or weight for that car seat for rear facing, they would then be forward facing. Children who are in a booster should be at least the age of 5. And then ideally in a high back booster, and then as they get to be older, elementary, moving to just a booster seat. And then they technically should pass the 5-step test to ride in a car without a car seat.
Tell us about some of the safety seat programs that they have, like the one at Target. I know you can bring your old car seat back and trade it in for a gift card for a certain percentage off.
So it's always best to just kind of check to see what are the resources in the community to make sure that your child's able to ride safe. So a lot of car seat technicians do have access to state funds that we can use for car seats too. So sometimes I'm able to get a car seat for a family who can't afford a car seat.
I'm here today with Bilky Joda Miller, and she is a doula. She is a post and prenatal massage therapist, and she also has a certification in fitness. She teaches us how to stretch. Tell me a little bit about pregnancy, stretching, and even if you're not pregnant, how stretching helps the body.
Well, stretching is very important. Flexibility, even when you're older, being able to be flexible helps you not fall so much. So with being pregnant, a lot of times your muscles are tight. You have ligaments that are stretching, especially if it's your first time, which actually produces pain. One of the things you can do even before that is start stretching using a birth ball, and it helps your body stretch better.
Give us some insight into what being a pregnancy massage therapist is like.
Well, pregnancy massage, which we usually call prenatal, can be done from the minute you find out that you're pregnant until you have the baby. In fact, sometimes as a doula, I do massage moms that are in labor. In the beginning of the pregnancy though, like until you're about 3 months or starting to show, it's just a regular massage to de-stress until you're actually showing enough that it's uncomfortable to lay on your body. At that point, then it becomes a prenatal massage. And I got interested in prenatal massage, and that's how I found out about becoming a doula. And then I just chose to actually go and do that training also.
So tell me about your doula experience.
So I have been a doula since 2013. And I really do that because I just love seeing those babies born. You know, 1 minute it's a big belly, and then all of a sudden there's a human being. And you look at that human being and you can't even think, how did that human being come out of this person? I've been through several births, and at the time of birth, it is always different. It's the same, but it's always different. You know what's gonna happen, and then all of a sudden it happens, and you're like, oh my God. And you know, people don't think of babies with personalities or characteristics or something, but even right then, there are some things you pick up on some babies.
What would you say the major differences are between being a post doula and a pre-doula?
Well, being a childbirth doula, everything you do is focused on the delivery. You are teaching, because part of it is information and stuff. You are teaching the mom and the family how to get to the point of what they want their birth to look like. And you are there during the birth, and you're helping physically during the birth time. With the postpartum doula, so then once mom goes home, that person steps in. I actually do both. If you are a postpartum doula, then you are there to help her do everything. I would cook, I do laundry, I give the other one baths, I clean out the toilet, I do everything they need. As far as the partner is concerned, I'm available for questions. We can have discussions and stuff. And if they need physical help with the baby, I can actually go. I usually offer them a couple of babysitting times that they can use me, that I can go over and watch the baby while they do a date night or something. It's really important to understand that not just mom has gone through this trauma, so has the baby and dad and siblings if they're siblings, because if you have another child and you leave and go to the hospital, especially like in my last labor and birth, so her other child has not seen her for that long, or dad for that matter, and so you have to make time for that child to actually be able to either call in or something when there is no stress going on, not when she's in a contraction, just so she knows, yeah, mom's coming back.
Please tell us about community baby showers and events that are going on now.
I participate in several of them. There's the community baby shower that is usually in April. And then we at Lansing Doula Network, we do our own. And there's a lot of donated products. There's a lot of free products, because those actually, we don't sell any of the stuff. We collect donated stuff. And Lansing Doula Network does a bunch of classes and stuff for moms, baby cafe, those kind of things. As the Lansing Doula Network, we have what we call Meet Your Doula, and that's like a speed dating thing where people come sit down and talk with several doulas, like for 10 minutes each.
It's all about the client. You get to pick and choose. You get to interview.
If I have a doula client, the people that are going to be my backup in case of an emergency are the people in the collective. I'm not going to be looking for someone else, and I always have to go ahead and have someone to be my backup, because I don't know what's going to happen. Like my last, again, client, her due date was September 13th. And so I could have been out of town because she went in 3 weeks early, and I'm on call 2 weeks before and 2 weeks after. But she had preeclampsia, so that's something we need to take care of. And if I had happened to be out of town or doing something else somewhere, I have to have someone that can be there for her.
How have you lived your life that's a lot of living and giving of your love and your time, and being in this space of people who are joyous, people who are just anxiety ridden. And then as the doula, you have no idea what is going to happen during this pregnancy, what type of medical issue, what kind of medical issue the mother's going to have. Well, the father might pass out, for crying out loud.
Well, actually, my last father, he doesn't deal well with blood and all of that stuff. So he was at the head of the bed, holding her hand, talking to her. So I was the one doing the other part of it. This was actually my first real induction. So I was lucky. Most of my births are done within 8 hours. This was almost 40 hours. And she's the one going through it. Yeah, I'm getting tired. But I'll tell you, there's a lot of adrenaline. When I got home after that birth, I didn't fall asleep right away, or even hours after they're done with that one birth.
I'm really grateful for the state of Michigan for taking the infant mortality rate very seriously, the maternal mortality rate seriously, because the maternal mortality rate is very high.
It is high, and you're right. The governor authorized Medicaid to pay for that. So now, if you can't afford a doula and you're on Medicaid, the state will pay for it.
Also, Ingham County is training new Black doulas this year, and I'm really looking forward to seeing a change in our maternal mortality rate and our infant mortality rate. So I appreciate you for being a part of that. We can all help mom by getting involved, helping cook, clean, and doing laundry, making sure that mom eats healthy food, engaging in relaxing activities like playing music, and making sure that the other children are taken care of. And also remember to compliment mom. Encourage the mother to seek help if she is feeling depressed or overwhelmed. This is a very stressful time, but reassure her that her feelings are valid and normal. And if she's feeling depressed, encourage her to seek professional help. We hope that you will continue to have the conversations about doulas and midwives and seek informative, engaging, culturally sensitive, and empowering information so that the Black community can continue to thrive in Ingham County and beyond. By addressing the critical gaps in targeted health education, we aim to significantly contribute to reducing infant mortality rates and advancing healthy births. As we conclude today's program, we'd like to extend our heartfelt gratitude to our sponsors, whose support makes this initiative possible. A special thanks to the Michigan Department of Health and Human Services, dedicated to supporting community-led efforts in Prosperity Region 7.